Why does a student with a gold medal still feel like a failure the moment a real patient sits in their chair? It's because you've been lied to. You've been told that practicing on plastic mannequins is enough. But in the real world, a mannequin doesn't bleed, it doesn't move, and it doesn't sue you for a mistake. If your hands are still shaking during a basic extraction, it's not because you aren't smart, it's because you've never actually felt the physics of live tissue. Today, I'm showing you why simulated training is actually holding your career back. I am Dr. Atul Soin. Technical knowledge is a trap if you don't have the tactile skill to back it up. To run a profitable clinic, you have to move beyond theory and master the physics of dentistry. In this deep dive, we explore the biology and the psychology of why treating real people under expert mentorship is the only way to kill your clinical anxiety. Chapter 1: The Physics of Tactile Feedback. The first reason live patient training is vital is tactile feedback. In a plastic model, the resistance is uniform and fake. But in a human mouth, every patient presents a different challenge. You need to feel the difference between healthy dentin and soft carious tooth structure. You need to understand the give of the periodontal ligament during an extraction and the specific vibration of the handpiece against different bone densities. At Ahead Academy, we teach you to listen to your hands. This tactile intelligence is what prevents major procedural errors like perforations or instrument separation, mistakes that cost you patience and reputation. Chapter 2: Managing the Biological Variables. The second pillar is managing biological variables. A mannequin doesn't have a tongue that pushes against your mirror. It doesn't have saliva that destroys your bonding site in a split second. And most importantly, it doesn't have a gag reflex. Professional dentistry is about field management. How do you maintain a dry field when the patient is moving? At Ahead Academy, I guide you through these real-time challenges. We teach you to manage soft tissues and patient comfort simultaneously. This is where true clinical speed is born, not by rushing, but by mastering the environment. Chapter 3: The final and most critical reason is complication management. Every dentist looks great when everything goes perfectly. But what happens when a root tip fractures? What happens when you hit unexpected bleeding? On a model, you just reset the block. In real life, you have a panicked human being looking at you. This is where chairside composure is built. By training on live patients under my direct mentorship, you learn the exact protocols to handle complications as they happen. We turn your panic into a professional procedure. To summarize, models teach you the steps, but live patients teach you the surgery. Stop practicing on plastic and start building real-world muscle memory. Contact us at the number below to view our batch schedules and live patient curriculum. Join us at Ahead Academy and bridge the gap to clinical excellence today.